My name is Robin Choudhury. I'm a consultant cardiologist and professor of cardiovascular medicine. Well, people ask me from time to time why I became a cardiologist. And I think the real reason is something we all know, which is that the heart is the most important bit. And we can delve deeper into why that might be the case. But for my patients and me alike, there's a very strong sense that the heart is at the core of something important. And it's not only why it needs to work well, but it's why people worry about their heart. And I understand that in my clinical practice. When people come to see me, they often have a lot of not only symptoms necessarily, but a lot of concern about what those symptoms might represent. After all, they're worried that they might have a heart problem. So I think besides helping to understand what's going on in the clinical sense, one of the most satisfying parts of the job is to be able to allay fear, because a lot of my patients come with a lot of fear. And I know, both as a patient and as a relative of patients, that this sometimes can be at least as big a deal as the disease or the problem itself. Well, I try to take the view that each patient is coming to me not only with a different clinical problem, but with a different perception of their disease and a different set of anxieties about the disease. So what I try to do is to understand where the patient is coming from, what they need from the consultation, and to address that, to explain with clarity what I think is happening, to give the patient opportunity to answer questions and to explore their concerns, and enough information to make decisions about their own tone and nature of treatment. Of course, it goes without saying that we try to provide outstanding facilities and state-of-the-art medical investigation. But what I try to add, is the ability to understand where the patient's coming from and what they need from the encounter. No, I don't think I have a mantra or a catchphrase, precisely for the reason that I'm trying to hear what each individual patient needs. But if I did have an approach, it's about trying to understand both the clinical presentation, symptoms, and to deal with that. That's very much my job, but also to really tune in to what the patient's worried about, how I can help them not only in the moment of the consultation, but when they're outside and they're worrying and they're speaking with their relatives and families, so that they have information that they need in order, as far as we can, to allay that anxiety.